I'm Dr. Naveen Kella. I'm a urologist in San Antonio, Texas. I'm going to talk to you a little bit about treatment options for BPH. BPH is a condition where the prostate is enlarged. It happens to all of us as we get older. All men start to have some degree of BPH, and at some point people find that their stream that used to be really strong when they were younger starts to get constricted. They may not stand up anymore, they may have to sit. These are all some of the issues that we have with BPH. So it's a problem that affects all of us. It's something that's not always brought up. It does definitely affect your quality of life, and at some point you may be referred to see a urologist to try to figure out treatments for BPH. Rezum and Urolift are really minimally invasive treatments that can potentially be done in the office. Now, medications for a lot of patients, if you think about it, it's a lifetime. You're going to be on Flomax or finasteride or even daily Cialis for your lifetime. With Urolift, with Rezum, these are procedures, so procedures will go through the risks of what could potentially happen, but these therapies should give you better results than the medications alone. And Urolift and Rezum, one of the key advantages is they have very little in the way of side effects. There's a chance of infection, you may have some short-term bleeding, but down the line you should have an improvement in your urinary flow without the sexual side effects that really made TERP so worrisome to people. Rezum is a therapy where we use water vapor. The water vapor actually rushes through the tissue and it causes the cells to basically turn off. And patients typically at 3 months are much happier with their urinary symptoms. They've stopped their medications, their flow is better, their urgency is better. They tell me that they can, instead of waking 3-4 times a night, now they're only waking up once a night. The effect that you get with the Rezum therapy is actually better than medication alone. Rezum and Urolift both have released data showing that they have good results 5 years after therapy, which is important because patients want to have something done once and have it last as long as possible. And so with Urolift, what happens is a patient will come to the office, similar symptoms, looking for an alternative to medication. And so it's exciting when there's a therapy that really has minimal invasiveness and can be done within a few minutes that could potentially provide you a lifetime of improved symptoms. Urolift, also like Rezum, doesn't burn your bridges to any other therapy. It doesn't burn your bridges if you have something fortunate happen down the line, let's say prostate cancer. We can still do surgery to remove the cancer. We can still do radiation to treat the cancer. So neither of these treatments will burn that bridge. People wonder, will the Urolift work better than the Rezum or vice versa? There's no head-to-head studies. We've done many men with Rezum and many men with Urolift. A couple of tests done beforehand, such as the ultrasound and the cystoscopy, which is a scope, can really help me tell if someone's going to do better with one therapy or the other. Both procedures, in my mind, are have about the equal amount of discomfort. I don't have to send patients home on pain medicines really with either treatment, although I leave it as an option. In my experience, Urolift and Rezum have about the same amount of chance of infection. Neither of them are that bloody. Both procedures could be covered by the insurances. Both procedures, if you're paying on your own, are relatively affordable. Remember, they can be done in the office potentially, so it can really keep your costs low.